So what we found in France was that during the summer, the acceptability of pandemic vaccine in summer 2009 was quite high, in particular among the general practitioners who are in charge of the seasonal flu vaccination among at-risk groups. Quite high means around 60 to 70%. And this rate was somehow decreased at some point at the beginning of September, a time where the controversy about the safety of pandemic vaccine started. And what we found, I mean, the most important thing probably is that two things is that one, the major determinant of the vaccination of general practitioners but health professionals in general was a former vaccination against the seasonal flu, and this former behavior was the main driver of an actual immunization against the pandemic vaccine. And the second point is to what extent doctors and the health professionals are willing to provide a positive advice to the population when they are not actually directly involved, meaning that what happened in France is that because the same doctors who are in charge year after year of the seasonal flu vaccination were suddenly not involved anymore in the mass vaccination campaign, then for most of them, they decided not to provide any advice, which had many consequences for people who were looking for advice at a period of time where they had many fears, either founded or unfounded at the time, but that had consequences on the immunization behavior of the population. There are major differences. So France had an actual uptake of about 8% as compared to initial plan to cover 75% of the general population. 8% means that in actual at-risk group, especially among people below the age 65 years old, it went up to 35%, which is quite low because these people were not protected. And eventually, among the 44 deaths that were attributed to H1N1, 80% were in these at-risk groups. And as compared to other countries, there is it's difficult to trace a pattern among Europe, but somehow there is, of course, a big difference between Nordic countries, where rates as high as 50 to 60% can be found in Finland or Sweden, and more southern countries like France, let's say Italy, France, Portugal, or Greece, where the rates were below 10% and even less than 5%. One exception that we discussed this morning was Spain, but that had a kind of Nordic pattern for this specific epidemic. The thing is that about 60% of the general practitioners, when asked, even though they were vaccinated, were not willing to take the responsibility to provide a positive advice toward vaccination, because for this particular event, the pandemic vaccination, they were not in charge as compared to the seasonal flu vaccination. I think there are many lessons to be driven, to be taken out from this somehow sad experience. The first lesson is that the main determinant of vaccination is a former vaccination against seasonal flu, and the take-home message in that case would be to say that the more you achieve a higher coverage for seasonal flu vaccination, the more you'll be prepared for any new pandemic, whatever the level of severity, because people are keen to get vaccinated and would be less reluctant or less susceptible to safety vaccine risk. And the second message, but that might be particular to, this is a kind of general message because it works either for GPs, either for healthcare professionals, or for the general population. And in any published studies, this is the main link we can find. What's more specific to France is related to the healthcare system, because we don't all rely on the GPs to vaccinate the population. In that particular case, but it's difficult to anticipate, if the target is actually to vaccinate at-risk group, which means not the entire population, then it's probably better to rely on general practitioners for a defined at-risk population, which for that particular pandemic was the case quite early. What's the negative message for the future somehow is that all people were forced to take a decision about vaccination, pandemic vaccination, which for a vast majority of them has never been the case, because seasonal flu is usually the target populations are people older than 65 or those at-risk groups with chronic disease below the age of 65. So for all these people who never took a decision about seasonal flu, and that now have taken a decision against pandemic vaccination, then it's somehow hampering the chances that they will take future seasonal flu vaccine.